Tell me about the Mental Capacity Act.
The Mental Capacity Act is a law that protects people who can't make decisions for themselves. It says we must assume capacity, help them decide, and always act in their best interest.
That's correct. Can a patient have capacity and still make a bad decision?
Yes, absolutely. Capacity just means they understand the risks.
Exactly. It's about informed consent.
Right.
We respect their choice. Patient with fluctuating confusion. When do you assess capacity and which decision counts?
Capacity is assessed when a specific decision is needed. The most recent decision counts if capacity is present.
Exactly. Good.
A patient refuses food, medication, and hygiene care. Is it a capacity issue or choice? First, I'd assess their capacity. If they understand the consequences, it's their choice.
Exactly. Good approach. Does making an unwise decision mean they lack capacity?
No, not necessarily. Capacity is about understanding, not the decision itself.
Good. So we assess their understanding.
Exactly.
The patient lacks capacity, no family around. Who decides what is in their best interest? And based on what?
The medical team decides based on clinical evidence and professional guidelines.
And if there's conflict?
An ethics consult.
A confused patient keeps trying to leave the ward. Do you stop them or let them go?
I would stop them. Patient safety is the priority. I'd try to de-escalate.
Good. Always prioritize safety. De-escalation is key. Where is the line between protection and restriction?
That's a tough one. It's about finding balance and involving the patient. Exactly. We need to respect their wishes.
I agree. Where is the line between protection and restriction?
That's a great question. It's about finding the right balance.
Exactly. How do you handle that?
Communication is key.
Where is the line between protection and restriction?
That's a great question. It's about finding the right balance.
Exactly. How do you handle that?
Communication is key.
A patient agrees to treatment, but seems unsure and pressured. Is that valid consent?
No, that wouldn't be valid. Consent must be given freely, without any pressure. Exactly. That's a key point.
Patient doesn't speak English. Do they lack capacity or just communication support?
Communication support, definitely. We need an interpreter.
Exactly. Always assess that first.
Right. I'll note that.
You know what the patient wants, but legally you're not allowed to follow it.
Do you follow the law?
Or the patient.
That's a tough one. The law, but it's hard.
What are the principles of MCA? The 5 principles are assume capacity, support decision-making, unwise decisions don't mean lack of capacity, act in the person's best interest, and use the least restrictive option. Excellent, that's spot on. The patient understands some things, but not all. Do they have capacity?
I'm not sure. They seem inconsistent.
Exactly. How would you assess that?
By their understanding of consequences.
Patient later regrets a decision. Does that change capacity?
No, it doesn't. Capacity is about the ability to decide at the time.
Even if the outcome is bad?
Yes, we can't judge capacity by hindsight.
Capacity not documented clearly. Is that a legal risk?
Yes, it could be. It leaves us vulnerable to lawsuits.
So what's the best practice?
Always get a capacity assessment and document it clearly.
Got it. Family members disagree with each other. Who do you listen to?
I would listen to the patient first. Their wishes are the priority. Then I would mediate, explaining the medical perspective to the family.
Patient is not detained but tries to leave. Do you stop them?
No, I wouldn't physically stop them. I would try to understand their concerns and explain the risks while documenting everything.
When does care become deprivation of liberty?
I think it's when the restrictions outweigh the benefits for the patient's well-being and their autonomy is compromised.
That's a very good point. Patient previously refused treatment. Do you follow it now?
I would first assess the patient's current capacity and wishes.
And if they still refuse, we respect their autonomy. No time for full capacity assessment. What guides your action?
I follow the ABCs, airway, breathing, circulation, then I reassess.
Good.
And if vitals are unstable, call a rapid response.
Patient suddenly confused. Can they make decisions?
We would assess their capacity using the 4 criteria: understanding, appreciation, reasoning, and communication.
Good. That's correct. Patient insists on going home unsafely. Allow or prevent?
Prevent. We have a duty to keep them safe.
And if they refuse?
Document and get a physician consult.
Who should assess capacity, you or someone senior?
If it's straightforward, I can. But for complex cases, I'd consult a senior colleague.
That's the right approach. Good. Following the law goes against patient wishes. What do you do?
I would explain the legal constraints and work with the patient to find an alternative that aligns with their wishes.
Good. Communication is key.